In total, Haiti Cardiac Alliance has identified over 200 children who have critical cardiac issues that require surgery. Of those, at least half have conditions that can't be dealt with in Haiti. It's not just the surgery itself, but it's also having a good intensive care unit to be able to handle the children after the surgery. So that was one of the reasons we were so excited to start working with Health City Cayman Islands, because we knew that they had these abilities that we simply don't have in Haiti right now.
The fact that these children have been made whole and they can lead more productive lives, I think that's something that is extremely gratifying, not only to the hospital but to every single staff who's involved in this. I think, you know, for anybody who works in any kind of profession, you need to be able to relate to something that's higher than just maybe maintaining your, food and money. You need to be able to see some higher purpose, and I think for us, that's extremely gratifying when you do something like this. You see children who can now lead fully productive lives. I think at an individual level, you know you're part of this bigger mission that's there, and that's something that's wonderful.
So because of the infrastructure as well as this experienced team, where there is doctors or cardiologists, anesthesiologists, intensive care specialists, physiotherapists and nurses, all matters. It's not one specialty. It is maybe 4 or 5 specialties with a very experienced team of doctors and nurses. So all this makes the recovery so fast. That's why on 5th day we can discharge after such a major complex procedure.
So in the first group, we have 4 kids with 2 children having surgical hole in the heart and other problems, and 2 kids with tight valves.
Definitely it's more challenging, and skill-wise you need a different set of skills to handle pediatric children. I mean, children with heart diseases, both in anesthesiology and intensive care, right from their tubes to drug dosages, everything has to be diluted to the minutest drop.
It was a pleasure for everybody at Health City to actually be involved in helping the 4 young kids from Haiti. So we worked with the Haitian Cardiac Alliance. So the fact that we've actually reached the point where we can start to do charitable cases is something that's close and dear to everybody that works within Health City's heart. Because, no one's socioeconomic status should determine their access to health care. Is the purpose by which this facility was actually built, the bedrock. And it couldn't have been done without Digicel, who was kind enough to loan us one of their private jets in order to make this a reality.
We feel it's very important when you invest in a country that you also invest in the social infrastructure of that country. So this initiative was exactly fit that mold. So wherever there's a need and Digicel operates and has a presence there, we'll certainly be willing to partner with Health City in that initiative.
When we started the hospital project, we announced that we were going to do free heart surgeries and do low-cost heart surgeries to people in need in the region. That's a part of the philosophy of the hospital. That's a part of our nature, culture. And Have a Heart was derived out of that to raise money to be able to support that project.
I started Have a Heart with 4 free surgeries, and then we brought a friend of mine called Manu, Chatlani, who helped, and over the years we've crossed, I think we've done about 6,000 surgeries. Well, we're looking for people that and kids that really need it, and we've traveled the Caribbean, and Haiti was the first one that jumped up. So we've identified 21 kids that we will be bringing down. 4 have come, and there'll be 3 more batches of the other 17 kids.
They told me that they are happy because they will be able to play more and do exercises and stuff like this. They couldn't do it before because they had difficulty breathing before, even walking or talking. But now they are feeling better about this.